So hello everyone, welcome back to the This is Public Health lecture series, which is brought to you by the Swiss School of Public Health and by ETH. If you have been following the series, then you will have just had your midterm break, and I hope you've all had a very nice and very happy Easter. For those of you who don't know me, my name is Emily Reeves and I'm the moderator for this lecture series. I'm based at the Swiss School of Public Health. If you're not familiar with me from this lecture series, then you may have already come across my name in association with the SSVH Plus Expo project, which was all about sustainable development goals in Dubai. Well, at the Expo in Dubai, that is. And as usual, at the start of every lecture series, I like to open up by encouraging you to scan the QR code that you see here in front of me. And this QR code takes you to a quiz that was developed by faculty members and by students of the SSPH Plus wider community. And it's all about public health in relationship to all the sustainable development goals of the United Nations. So if you haven't checked it out already, then I encourage you to scan the QR code in front of your screen now and take a look at it. And if you have any feedback to that, I'd be grateful to receive it via email. So I've left my details there for you. As always, I like to keep this link highlighted that you see there, which brings you to a support page for counselling services and support services for students in particular. These support services happen to be at ETH, but there are plenty of support services across different universities here in Switzerland. And I mention this now because, of course, we are living in very strange and difficult times at the moment. So if you have been affected by anything that's going on the globe at the moment, then please know that you're not alone and that there are support services out there for you. Don't hesitate to get in touch with me as well via email, should I be able to direct you in the direction of additional support services. Always happy to help. So as I mentioned, you have probably come back from the Easter break, and in between eating chocolate Easter bunnies and enjoying your time off, you will have also had time to hopefully look at the midterm exam. If you haven't looked at it yet, then don't panic. You still do have a little bit of time, and that is until the 3rd of May. Very specifically, you have until 23:59, so just 1 minute before midnight. So just letting you know that's the deadline. If you have any questions to that, please don't hesitate to write to me directly via email. And please do not forget to do that in time, because it is a very important, in fact, essential part of the course in order for you to be able to gain the 1 credit point for taking this course. So please don't forget to do that. If you do forget to do that, or if you're not able to complete it or are not able to pass it, then you will have to do another assignment. So please don't forget it. It has been posted onto the Moodle platform and it will be there until the 3rd of May. So that brings me, without further ado, to the lecture of today, which is on patient participation. Specifically, the title is How, in brackets, can it work, which gives us perhaps a sense of hope here. I'm sure we're going to find out a lot more about this topic now from Dr. Heidi Kaspar, who is a co-lead at the Competence Center Participatory Healthcare at the Department of Health Professions at the Bern University of Applied Sciences in Bern. So it's really a pleasure for me to be able to welcome Dr. Kaspar, who's with us today, and to hand over the word to her. Thank you very much. The floor is yours. I will now stop sharing my screen so that you may share yours.
Fantastic, and thank you so much for having me here. And yes, I just started the presentation, so we're ready to go. Please give me a short thumbs up if you can see that. Okay, wonderful. Okay, welcome to everyone. So I'm really glad to be here and to talk about the role of study participants and service users. So this includes, actually, the title is about patient participation, but actually I want to have it a little bit broader. So we're talking about health care in a sense, not just what happens in clinics and hospitals, but also about health promotion. So when I say service users, that is broader than patients, obviously, but I also imply non-users, in fact. So that would mean basically everyone, the public, as everyone could be, or everyone is actually a potential user or a former user, a future user, etc. So we talk about involving people in health research and in health care. And actually, participation is a confusing term. We use it to describe many different things. For example, you participate in this lecture. You also participate in politics when you vote. We talk about social participation, for example, when you spend time in a public space or with friends. And when you fill in a questionnaire, you participate in a study. The list goes on and on. So maybe take a minute and think about your last project, or one of your last projects, or the current projects you've been doing. And jot down, you can do that mentally, or you take a pencil to write it down. Were there any people involved in this project who do not work at a university and or who don't have education in science? And what were their roles? Come back to your notes written down or mental later in the presentation. See, how do I go forward here? Yes, I think now you can see the overview, right? Yes. Good. So the presentation, I've organized it into 3 parts. First is an introduction to this research approach. I'll give a definition and key characteristics. Then I briefly give an idea about where participatory health research comes from. And then we go a little bit deeper. I'll talk about what matters when implementing participatory research in research and development projects, and present some methods that are widely used. In the last part, I'll present experiences from a study I'm conducting to give you a plastic idea about what it actually means to do a participatory research project, when it unfolds. And I'll conclude with some do's and don'ts and some suggestions for further reading. So since about the year 2000, we witnessed a revival of participatory approaches. This includes, and actually Beresford and McLaughlin, they write that these approaches are actually taking off. So there's really a momentum now for these for this kind of research doing. And they also state that it has become a global movement. At the same time, but also I like to mention that it's not yet mainstream, and it challenges actually quite many practices and assumptions in conventional research and also practice in healthcare. So what is it exactly? Maybe you have read about studies that conduct a survey with patients on their satisfaction with the treatment in the hospital, and you'll find the keyword participation on the paper. Maybe you've also read the study about a project that works with people with mild and moderate dementia and their caregivers to investigate how support services can be improved in a way, and particularly in a way that they are empowering for people with dementia. And that in this study, actually people worked with people with dementia to analyze data and kind of distill from interview data what works for people with dementia, and actually working with theories So, and it would also have the keyword of participation on the paper. And obviously these are quite different things, but both claim to work with participation or be participatory. And perhaps the most important message from this lecture is that there is on the one side participation in health research, and there is participatory health research. And both work with participation, but it's not quite the same. Or you could also, of course, this also applies to healthcare, so to practice, not only to research. An example with the survey is rather about participation in research, whereas the latter example is participatory in character. And tonight I'm going to focus on the latter, so on participatory research. So here is one definition. There are many different definitions out there, but they all would make a clear argument, or maybe the core of all these definitions is that participatory research is about researching with participants, maybe service users or patients or caregivers, rather than doing research on them or for them. So, and I really think it's important to make this differentiation. What it implies if you do research with participants is actually that you decenter your own as well as practitioners. So you bring in your expertise as a health or science expert, but then you have participants who bring in their own expertise, which basically is based on their experience. They might also bring in other expertise, but they have their own experience. And you have to be kind of willing to see this as an experience at kind of the same eye level as your own in order to kind of be able to apply participatory research. Is kind of the basic, the basis for everything. So decentering scientific or professional knowledge is kind of a prerequisite that has to be there. So including these diverse sets of knowledges is an essential objective of participatory research. And maybe it's important to mention that articulating this know-how, this expertise patient service users bring in might not be easy for them, even if they're invited, because it goes against former experiences often, not necessarily, but often. They're not used to kind of be asked for their know-how. They might also have other experiences in other areas of their everyday life where they are marginalized and maybe looked down, devalued. So it needs perhaps it needs preparing the stage for them to build trust and to make an environment where they actually feel, yes, I can articulate my experiences, my views, my needs also. So we need to build partnerships that set the stage and put people in the situation that they're actually in the situation of expressing themselves. But what is the purpose actually? So this is an important thing we need to do, build these partnerships, but what is the purpose of building these partnerships of involvement, if you like to say? These, the purpose can, there are various purposes. I've listed here 5, in fact. One that are quite common. One is to improve the quality of research. So you want to involve service users because you want to improve the quality of your research. This can be because you want to improve or increase relevance of your research. So you feel like if it's really contextualized, it's anchored with the needs of service users, and you can also increase the impact of your research, because you already have established a link to the community you like to reach. Improved quality also means you have access to informants, so it's like a facilitation. They are gatekeepers, so you gain access to the field more easily. Another goal is you want to improve quality of services for better health outcomes, and you actually need to know where do service users stand, what are their needs and experiences. So you want to learn from them. Another goal is that you want to improve people's living conditions, and you reduce inequality. So usually there is a focus on marginalized people here, but not necessarily, but the focus is on marginalized people because generally speaking, they have poorer living conditions, poorer health, they are less heard anyway, and they have less access to healthcare, so they're disprivileged in many senses. And finally, another goal is that you want to empower service users or potential service users. And you might guess it, whereas the first two goals are quite common, the latter ones are also prominent, but far fewer studies actually have this as their goals. And actually, there's a differentiation here, maybe, that could be made. Anderson's differentiates between like kind of a northern and a southern tradition, and the goal 1 and 2, they could typically be seen as the northern tradition that he describes as utilitarian in character. So in other words, participation is a means to push an agenda. So you want to improve something, that is your agenda, and you use participation as a means to do it. And goals 3 and 4 are rather typical for the Southern tradition. They are coined by transformative learning. So here participation is applied as a means to liberate and empower people. Now, think about your project again. Does any of these goals you see listed here on the slide apply to your project? And which one? And why do you think this it applies? Very well. I'll continue. Sorry, I have to get back. Here we are, right. So I continue with the 11 principles of participatory health research. You'll also find other quality criteria or characteristics. These are the 11 principles that you can find in the reading material Emily has sent out to you. They are from a position paper authored by the International Collaboration on Participatory Healthcare. And I think they're quite good and give you a good orientation point. Sometimes they're kind of interlaced, so not quite discrete, but I think they give you good orientation. I'll not go through the entire list, but say a few words on the first ones. So the first one seems kind of obvious participatory research is participatory, but what the paper means is that what I said before, that it's not participation in research, but actually participatory research. And they also go on to explain that there are different levels of involvement, and they qualify some as participatory and others not. I'll come to that in a minute. What they also state is that the goal of participatory research should always be to have the maximum of participation. I'd like to comment on that, because although I think, yes, it's good if when we start with the project, we think like we should kind of strive for to have it to give users the strongest role we can give, but we have also to keep in mind the situation we are in. And sometimes the maximum is not the best way. So we have to think about the resources we have in financial and time, and the constraints overall of the project. So sometimes the best way is probably not the maximum of participation. It's better to do participation at a lower level, but in good conditions. Yes, then the second is participative research is locally situated. This means it's relevant for actual situations, for communities, for individual people. It's also embedded in their everyday life. So participatory research is always contextualized. It has a local character and an asset. And sometimes people ask, so, but if it's so local, how is it generalizable? How can we work with some more abstract concepts? And you might be doing that, but it's definitely not the first your main objective. Your main objective is to be relevant at the place you're working. And was that a question? No.
Sorry, I didn't know I was unmuted. Sorry.
No problem. So I move on to the third point. It is a collective research process. It's kind of interlinked with number 4. And that means also that it is collectively owned. So all steps, ideally all phases and steps and tasks of the research project are done collectively by scholars and service users. It also means that it's not just scholars, people from universities who are researchers, but we actually understand the participants as co-researchers. And it does not take an academic degree to become or to be a researcher. It also means that decisions are taken together and there's a shared responsibility. Number 5, about transformation. So this point also relates to learning, and actually a process of co-learning where all participants, scholars and co-researchers learn from each other and bring in their various expertise and bring these expertise into fruitful discussion. So it's not about educating people. So participative research, I think you guessed it, is really an umbrella term. It's there are many different approaches, and some of them are probably the most prominent for the field of health. I've listed here one that is very prominent in health is the user involvement or patient and public involvement and engagement concept. It is very strong in the UK. It is very established there. So there are actually user-led research teams. There's user-led teaching there, so it's pretty established. But there is also critique of this PPEI that because there is a lot of actually funders really demanded that you have it in the research projects. So you feel like in the UK, there's really a good environment to do participatory research projects. But then again, scholars say when you look closer, you see that many of the projects, they do participation, but at a very low level. But nevertheless, it's really important to mention. So if you want to engage with user involvement and PPIE, then look to the UK. And maybe it's also important to mention that this is an movement very strongly influenced by mental health and people who have experiences with psychiatries. Some of them call themselves survivors, and so this is a movement that has really was very much informed by their talking back to the system. Another approach is a community-based or community-partnered participatory research. Here you work with communities rather with individuals, as the name says. Usually it's communities or marginalized people who have no good access to healthcare, and you work with those communities to better understand their living and health situations, and also to develop solutions and answers or responses to that situation. The approach of co-creation, co-production, or co-design is largely used in the field of health technologies. These are concepts that come from within the IT field, so it's from technological development, and basically comes from Scandinavian countries. And here the idea is that, so this is like an evolution from usability studies. So usually you would develop a prototype and then you would test it with users, and then you would adapt it so that they can best, so that they have a better use experience. But then they realized it's actually important to involve people at the very beginning, not towards the end of the process. So co-creation really means that that you have users and researchers and designers and developers, etc., in one team, and you create ideas. You do the ideation process, and then the entire life cycle to develop a product. Participatory action research is very much about action, again, as it is in the title. So here it's the focus, it's research, but we really do that to develop some initiatives and improve the living situations of your target group. Not very prominent in the field of health is citizen science, but I'd like to mention it anyway because it's gaining a lot of attention in other fields, such as sustainability studies and science in general, where you actually use that public or work with that public. Usually it's to collect data, but there are also projects that go further and actually give citizens a say in the entire project and have a more, to say, participatory approach. Yeah, maybe these are different, a little, to say, way to organize different approaches in healthcare is this this slide, or yeah, maybe with the differentiation that there are various approaches or trends to empower users in healthcare, and they can be divided into those who those who focus on health professionals, so they are in a better position to understand and integrate the needs of patients and caregivers to the care they're giving. And the other approaches are working with patients and service users and enable them for self-management. The key means here are information and education. And these two approaches both work or support, in fact, then that users, professionals, and researchers can work together, build partnerships, and co-create and co-produce health care. So just a few words on the history. Actually, when we talk about, so I said in the beginning that there's a revival of participatory. There's this revival of participatory approaches, but they date actually back to like for health, they date back at least 50 years, and in other fields even 70 years. And grassroots and right-based groups are really important. They kind of made the claim and documented that harm is done or had been done to marginalized group, and that is based on this documentation and raising their voices. They claim that they have to have a say. Maybe you've heard about the claim, no research on us without us. Critical and emancipatory thinking is very important, has been very inspiring source, and also mental health, med studies, but also disabilities, post-colonial feminist studies have been important. And of course, participatory research is not only applied in healthcare, but also in other fields, such as development studies and social work. So when you implement, when you implement participation in research, there are, how do you do that? First of all, I think as in every research project, there are some decisions you need to take. Call it here differentiations between various kinds. So the first one is actually you have to decide whether you want to do participatory research, so use participation as a style or approach, or you want to have it as a method. This links back to the goals I presented earlier. So whether the decision here is whether you want to have a partnership and share responsibility, and also the level of the control you have over the research with your co-researchers, or whether you need to have it in your own hands and you as a researcher are the one who drives the process. The second decision you need to take, of course, is who gets involved, who actually you need to or want to have part of your team. So broadly, you could decide, is it health professionals, or is it service users, patients, or the public at large? And I think it's, or maybe you want to have both of them. It's important to think about who the people are, what is their position vis-a-vis yours, to know the kind of situation you need to prepare to come to actually build a team and a partnership. So you need to have in mind the power relations and the asymmetries that play within the group. And then, of course, you need to think about the level of involvement that you want to or you need to achieve. There is one in the paper of the international, in the position paper you have. Here is another one I brought with me because it's a classic and it's still cited. So this is the level of the ladder of involvement of Arnstein, and you can see here it's similar to the one in the paper you've read. The important thing is that they differentiate non-participation then from degrees of tokenism to citizen power. So at this point, we could go back again to your project. You could think, where would you place your project? Maybe I'll leave that because time is progressing. There is another like graph of level of involvement that is an adaptation of Ornstein's letter of involvement. I just brought it with me because it's a little bit more differentiated. So you can see it's not just the level of involvement, but also described in various fields. And what I like is that it has also the below on the yellow bar, factors influencing engagement, which is really important. You need to reflect and think about, like with respect to the patient or user, organization, and society, where is the position, what might influence, in this case, the engagement, and what do you need to address. So as participatory research is not a method, but rather a methodology or a paradigm, you need actually research methods to work with extra, so to be combined with your participatory research. And there are various different kinds. Basically, you can use any. Usually people work rather with qualitative, creative, mobile, visual methods, but of course quantitative methods is not excluded. The most important question is to reflect on so how can I provide a situation that allow co-researchers to voice their experiences and concerns? And then based on that, you can choose your method. The method is actually really a tool that facilitates raising the voice. So that is the important question. Good. And finally, I'd like to briefly present, maybe just say a few words because we need time for questions and discussions about the research project we are conducting. We're using a community-based participatory research approach. Co-production is very important for us. The partnerships we built was with very diverse, it was with different sets of people. You could say the public in general, so residents of that area, professionals as well as political leaders. And the goal was to establish or initiate caring structures or complement caring structures. So that was the goal, so build actually caring communities. But what exactly and how and for whom was collaboratively defined in these communities. So we offered actually a very vague idea of what we would like to do, and then kind of invited people to join us and think along with us what this place could need, or what could improve the living in this at this specific site. The idea was to first explore needs and then develop and implement initiatives and then evaluate and adjust teams. So 3 steps, if you like. And to do all that collaboratively. And I just share some experiences from the process we've been doing. It's actually really a journey with ups and downs, and I feel we have made some achievements, and at times it worked very well, and at times you feel like, well, yeah, we could have done a better job. And I think so. Nothing is perfect, and you can, but it's important to learn from these experiences. So one I'd like to share is actually on establishing partnerships and ownership. In one lab, the co-researchers were actually really enthusiastic about doing research and about doing real research, but they were reluctant to take over control. So they would say, like, you're the expert, so you know how to do research, so you tell us what to do and then we do it. And we were saying, but we need your knowledge as well. You have the local knowledge, and we actually really want to value and integrate that. And it took some kind of time for everyone to learn that. And we also had to accept that maybe in the research part, when we do the study, we as scholars, we take the leadership. And then there was an interesting incident so we would say that we would invite people to share their personal stories as well. So these researchers, they went and interviewed people in their community about their situations and care needs, actually. And when we were analyzing the data together, people would start sharing their own experiences and ideas and views. And one of the researchers would say, one of the co-researchers would say, well, actually now you should stop telling your own stories because we're analyzing data. And we're not just chatting, but we're doing work. And she didn't want to have these, what she called subjective views in the analysis part, where actually we, with the academic scholars, we actually valued these and would have liked to integrate it because we thought this is additional data and it's also important. And so this was like a negotiation of what actually counts as research data. And it also shows that sometimes there are negotiations. So we come in with our ideas and say that there are different experiences that we want to value, but it might not necessarily be shared with the people we work with, so with everyone. But then on the other side, there was so it was like a balancing act, and we felt a little bit more, sometimes more in control than we actually would have wanted it. But then something happened that showed us, or that kind of made people co-researchers take more control. A person joined the team. She is a political leader there, and she felt that this is a great project, and she then wanted to kind of said, okay, now we have to do that. So she took on the role of a leader very easily, but then the group kind of persisted and said that they didn't want that kind of thing because they were doing everything collaboratively in partnerships, in a partnership. So that was a situation where actually then that joint ownership and also steering kind of came through. Yeah, I have here also share some experiences on balancing scientific and local agendas, which is not always very easy, and also on the impact we made. But I think I'd rather stop here so and give time for questions. And if there are no, I can still elaborate on that. Would that be fine?
Yes, thank you, Dr. Kaspar. That would be great. I think now we have the time then for handing over to the three students who will be moderating this discussion time. So then I open the floor and I let one of the first students bring their question. And in the meantime, those of you who still have questions, you can always write the questions into the chat, and those who are moderating the Q&A time will then either read your question from the chat, or you can also unmute yourself and ask a question. So Umar, I hand over to you.
Thank you, Dr. Reeves, and thank you, Dr. Kaspar, for the very insightful lecture on participatory health research. I have one question, might be a bit unorthodox, but my question is actually, when is it actually inappropriate to use participatory health research? Because I find the idea of like accumulating all this information with an acknowledgement of the certain power structures that might exist based on the context of what is being researched. There is a promotion of itself trying to go beyond the institutional practices, but it also seems like a double-edged sword where it can fall behind and stick with the social norms and also make them stronger. So how is that prevented, and when is it actually inappropriate to use participatory health research?
Okay, sorry, I couldn't hear you because your voice was breaking. I get the question so the question is, when is it inappropriate?
Yes.
To use participatory approaches? It's inappropriate. Thank you. I'm just realizing that I skipped the do's and don'ts actually, but so it's actually inappropriate when, so you would find that there, and you will get the slides, of course, but it's actually inappropriate if you say you'll involve people, but you don't actually do it. So if you kind of, so you say you want to involve them, but you actually just want to grab their expertise and run away, and then you run away with it. So meaning you use what people, the information people give you, the expertise for your own benefit and not for, so it should also, if you use participatory approaches, then the people who are involved should also benefit from what they get. And I think that is maybe the one important point. It's also not appropriate if you don't have the resources to provide situations that actually allow people to bring in, that like relate to the resources they have, and allow them to bring in their views and expertise. So that means probably you don't have enough time, because building partnerships really take time. And if you have to do your research project within a year and present results within a year, that I guess wouldn't work. You also should have some means for remuneration, I think. So to balance, you probably are paid by your institution, but researchers might not be paid. I mean, money is not always the thing, but there needs to be some leveling or balancing that. Yeah, these are probably the most important things. Does that answer your question?
Yes, thank you. I'll just hand in to the second moderator, Iliaka. I think she also had a question.
Yes, thank you for your presentation. There is also some questions in the chat. I will ask one of them. If we are thinking to involve children to investigate behavioral patterns related to health, where should we start, and what points should we pay attention to?
Behavioral patterns in health.
Yes,
Wow. Wow, that's a broad question. If you want to design a research project, I mean, maybe I guess you need to have a bit of narrow focus, but then the first question, actually, I think I'd start to think about who is this project, what kind, who is affected by this project? I guess that is the question I would ask myself first. Who is affected, who benefits, but who might also be otherwise affected? Then I'd start to think about what role, how could I work with them rather than on them? How could I involve them? And if you can involve them in early on by refining and narrowing down and your question, that would be actually really great. So if you're if the people your research is about can also work with you to define the actual problem you want to address, that's good. And actually, so it's a chance if you start with kind of a rather broad topic or question.
Thank you. I think Anke Berger has a question. You can unmute yourself.
Yes, thank you for the talk, Heidi. It was very interesting. And my question is, do you need an ethics approval if you include, for example, populations who could be vulnerable or bothered by the process?
Yes, I guess in many times you need it. It depends on where your research is based. So in Switzerland, we have that law on, how is it called? Human research. And if your research project falls within it, then you definitely need to have one. In the EU, they have other, and some institutes also have review boards. But I think, I mean, of course, you need to like adhere to the rules and be within this kind of legal framework. But then there are many other ethical questions that are not addressed by just the formal legal things. So, I mean, all along the way, you need to question where do we stand? How do we, how to say, do we do our best to facilitate that people can participate so that they have the means to? Do we create good situations? Do we create trustful, to say safe spaces actually, so that they can feel comfortable in saying, and also in how do you call widersprechen? Sorry. So in not agreeing what you say and offering their own views. So, and there are a lot of questions that you need to address to build this confidence and also to build competence. So does the thing do the things you want to do actually be within the range of the competencies? And if not, can you build them? Can you work on them?
So are they considered as a study sample, or are they something else in the design that need to be treated differently?
You mean whether they? I would say they should be considered
as part of the sample. Mm-hmm.
I think so, because it's affecting, what you're doing is affecting them, right? You're working with them and they're affected by the research. So for the project we had, we did not need to have an ethical clearance, a legal one, but I would treat them as samples, as study subjects.
Thank you.
Thank you for your questions and your answer. I will hand over to Annika for her questions.
Yes, thank you very much for your presentation. And there was also another question in the chat, so I'll read out that before I ask my question. The question was, can you please position the basis of scientific evidence, strength of evidence available, previous contextual information in your approach? Co-creation is a great way to intervention, development, and contextually adapted implementation strategies. Yet only relying on the local expertise might be too limited.
So, sorry, that was a long. So you mean, is there empirical evidence that involving users and patients is actually improving research?
I believe so.
My question was, and this is Sabina de Geest from Basel. My question was, first of all, thank you so much for a very interesting talk. And I really enjoyed listening to you, and I also admire your coolness, even being interrupted. I mean, that's high professionalism. My question is rather, you are referring to, and this is strong, going to local communities in order to then work with them towards a solution. There is scientific evidence, strength of evidence available on specific issues. There is previous contextual analysis available, which typically is being included in intervention development, and also the development on the basis of co-creation with implementation, contextually adapted implementation strategies. I have not really heard you to position this scientific evidence as such, and I wonder if perhaps I've misunderstood it. This might well be true, but if you go for a participatory research approach and you leave out the strength of evidence that is already available from other contexts, knowing that we have to adapt as we go into other contexts. So I just wanted to have your perspective, how you deal with that.
So first of all, I think, I mean, you have evidence, but then every situation is different, right?
Yes, but there is a whole intervention. I mean, we have intervention mapping, we have implementation strategy mapping, which takes into consideration this participatory approach, but very much also positions scientific evidence as such. And so this is the strength of scientific evidence can be integrated even in a participatory approach. And I might have missed it, but I didn't hear this in your talk.
Right. Yeah, we actually, of course, you can bring in your expertise at what you know about what works and what does not work when you work in a participatory way. It does not mean that you're an expert as well, and you would as well bring that in. And I feel in our project, in fact, we have probably not done that enough. I guess we're all learning, and it was important for us that we can work with the people and to come at an eye level. And we felt like we come from a powerful institution, which is university. So we didn't place ourselves, we placed ourselves rather as experts of a process than of a lot of scientific knowledge, because we didn't want to intimidate people. We might have actually missed to bring in the knowledge that is,
I would encourage you.
Yeah,
I would really encourage you to look into the methodologies of intervention mapping and implementation strategy context analysis from implementation science, as the participatory approach is guaranteed, but you will be much more effective in developing in co-creation and intervention that can land in a setting, and that also has the benefit of the previous scientific and even, participatory work that has been done in a local context. So I would just plea for not discarding that part in the further continuation, but appreciation for your work. And I wish you all the best for the next steps.
Thank you. And thank you for the hint. Yeah, that's great.
I saw perhaps we have just time for one final question, because I see that there's just one question which has gone unanswered so far in the chat. And that is a question here by Luyan. I'm so sorry if I don't pronounce your name correctly. I have a suspicion that I'm not pronouncing it right, but the question was, if we are thinking to involve children to investigate behavioral patterns related to health, where should we start, and what points should we pay attention to for investigating children, involving children and behavioral patterns related to health?
I already asked this question.
You asked this question? Oh, I'm sorry, I didn't hear that question. Well, that's great. Then it seems that we did manage, in fact, to cover all the questions that came up. And thank you so much to Dr. Kaspar for taking the time to go through and answer all of them. Thank you indeed for being with us, and thank you to those who took part as moderators and co-moderators of the discussion time. Thank you to you three. And then that only leaves us to wrap up, I guess, and to let you know that we will still have another lecture series taking place next week, as per usual. In the meantime, of course, you do have the midterm exam open until the 3rd of May, so just worth letting you know about that. Thank you once again for being with us. Thank you very much to Dr. Kaspar for sharing her time with us, and her knowledge and expertise was very highly appreciated. And as was previously mentioned before, also for your high professionalism given the very, very unfortunate and inappropriate interruption that we had earlier. I will see to it that we have IT look into this and perhaps look for a way that the Zoom meetings can be more controlled. Apparently this is a risk. I was very lucky until now not to have experienced something like this before, but these things can happen and do happen. So apologies to everyone for the rude interruption, and I hope that next week things will run smoothly again. So thank you very much to you all, and wish you a nice evening for now. Thank you and goodbye.
Bye.
Bye.
Thank you.